In order to promote the recovery process of a flexor tendon strain, it may be appropriate to load the fingers in a manner that promotes the recovery process. In order to achieve this, we actually want to place the grip in more of a half crimp or high angle half crimp position. And we're going to use our uninvolved hand as a nice comfortable grip. We're going to place the grip on the palm, and I'm going to actively push with my uninvolved hand into the climbing grip while I maintain the grip with my involved hand. This is what's called a yielding isometric. I'm actively meeting the resistance of my grip position without my hands opening up or losing that grip position. This tends to be a really comfortable way to start introducing load to a flexor tendon strain without placing too much stress or compromising the flexor tendon. Now, the reason for this is that you have two flexor tendons. You have the FDP, which attaches to the tip of the finger and attaches close to the elbow. And then you have the FDS, which attaches to the middle phalanx and actually crosses the elbow. Now, when we load the finger in a drag-like position, it primarily stresses the FDP tendon. And that's the most common tendon we see become strained when a grip fails and opens up, if a three-finger drag creates a lot of tension or stress on the finger. And so that's something to be mindful of as we start introducing loading. Now, if we place the hand in more of a half crimp or high angle grip, we now get contribution from the FDS tendon, because the FDS tendon's main role is to flex the finger at the PIP joint, where the FDP's main role is to flex at the DIP joint. So the more gripping that we do in more of a half crimp position, in theory, it should allow the fingers to be loaded with more force without agitating the FDP tendon.